Afternoon again, and thank all of you for joining our learning community today. I'm Beth Stroll with the Technical Assistance Network for Children's Behavioral Health, organized by the University of Maryland School of Social Work, and I'd like to welcome you to this month's System of Care Leadership Learning Community meeting. We may have some challenges today due to the snow and ice storm hitting the East Coast. University of Maryland is closed today, and our wonderful tech expert, Tiara Brown, is hosting this webinar remotely. So please bear with us if we run into any difficulties. So this session is part of the System of Care Leadership Learning Community. Denise and I co-facilitate this learning community. We hold it monthly, and it's designed to support leaders in systems of care, and that could be in states, communities, tribes, and territories, including those with federal grants and those without federal grants. We do try to address topics that are important and helpful to you in your work, and we always welcome your suggestions for future topics, so please feel free to email us if you have any ideas. This year, we're focusing most of our sessions on operationalizing various elements of the system of care approach, and that was a need expressed by many of you. And today's session will focus on operationalizing state-community partnerships in systems of care. We like these sessions to be as interactive as possible, and so we encourage you to put your questions or your comments or your insights in the chat box throughout the session. We have incorporated time for question and answer, and Denise and I will make sure that any questions you enter in the chat box are addressed by our presenters. And then I'd like to point out to you that just below the chat box, you'll see another box that will allow you to download today's PowerPoint presentation and other resources. And also as a follow-up, you'll receive a link to the recording of this webinar. And finally, at the end of the session, a link will pop up for a very, very brief evaluation survey, and we would really appreciate your hanging in with us for just a few moments longer before logging out to complete this and provide us with your feedback. We really do take it seriously, and we use it to improve our future learning community sessions. Before we get started, I'd also like to mention that our next learning community meeting is March 20th, also at 2:30 Eastern Time. And the focus on that one will be on a brand new and exciting learning opportunity that the TA Network is offering on communications and social marketing. We'll be working with frameworks, which I'm not sure if you're familiar with, but it's an interdisciplinary team of social scientists and communications experts, and they provide strategies for effective communication and will help us do that about children's mental health to various audiences. There will be a 4-part series that will be kicked off as part of our System of Care Leadership Learning Community in March. And following that, there will also be opportunities to participate in Frameworks online learning community. So check the TA Telegram and stay tuned for more information on that. Tiara also put the link to register for that March 20th event in the chat box for you. So we hope you'll put that on your calendar and join us on March 20th. Well, we have some really good news hot off the presses this morning. SAMHSA just released a funding opportunity announcement, or FOA, for a new round of System of Care Expansion grants. The long title is Grants for Expansion and Sustainability of the Community, Comprehensive Community Mental Health Services for Children with Serious Emotional Disturbances, but the short title, as we all know it, is System of Care Expansion and Sustainability Grants. It was just posted this morning. The due date for applications is Friday, April 19th, so there's a couple of months for you to work on it. There is a link on this slide, and it really is a great opportunity to continue funding your system of care efforts or to obtain funding for those of you who haven't had SAMHSA funds for your system of care work before. So we encourage you to check this out also. Another thing I wanted to point your attention to is a new learning management system that we've just launched at the TA Network. It's a platform that allows the learning communities to be more user-friendly and interactive. And it's a digital hub, and you'll be able to, through that platform, join LCs, the various LCs that we offer learning communities. You'll be able to register for webinars. You'll find recordings of previous webinars and resources that were provided during those, and also additional resources. And it also provides a vehicle for you to interact with your peers and with experts on the various topics. I wanted to let you know that the follow-up emails to each of our learning community sessions, which have come from Denise Solzbach, will now come from our institute through Absorb. For this one, Denise will send the follow-up email from her email address, and she'll give instructions for Absorb. But in the future, going forward, the follow-up emails will come from the institute noreply@myabsorb.com. So please be on the lookout for those and make sure that they are not going to your spam folder. The link to sign up for Absorb is on this slide. You can use your own email as your username and then click on Temporary Password Change Me. And you won't be able to use the system until you change the password, but you'll still get follow-up emails. But we encourage you to sign up and take advantage of all the features that Absorb will offer. And I'm going to turn this over to Tiara, who will show you a little bit about what Absorb looks like. Tiara?
And I'm just going to jump in, Beth, before Tiara shows all the fancy stuff with our newest system, to say that everyone who registered for this webinar, we did put you into the Absorb system. We put your name and email address so that when you go in and put in your username, which is your email, the system will recognize you and be ready for your temporary password Change Me. And then that will give you the opportunity to set up your permanent password. That allows us to send the follow-up emails, both through my email account as well as through Absorb for this first time. Go ahead, Tiara. Show us all the good stuff.
Thanks, Denise.
All right, so once you do log into Absorb and you change your password, you will come to a home page that looks like what we have right here on this web page. And so here you can see that you can access any online training housed through the Institute University of Maryland. You can also register for webinars, as Beth mentioned. You can also view our social media feed, so you'll have access to our live Twitter feed and our Facebook feed as well. And you're also able to sign up for our TA Network learning community, like the System of Care Expansion learning community. And so when you're ready to sign up for the learning community, once you're signed in and you've changed your password, you want to click on this orange box that says TA Network Learning Communities. And it's a little bigger right here. And so once you click on that box, you'll have access. You can see the 3 learning communities that we have set up right now, and to the far right-hand side, you'll see the System of Care Expansion Leadership. So yours will look a bit different. It'll say Enroll. So you're going to click on Enroll right where it says Completed, and once you do, you'll have access to a survey for your work with System of Care that we would love for you to take, and you'll also be able to register for webinars and view previous webinar recordings and monthly minutes that has all to do with System of Care Expansion. And you'll also have access to resources. So any resources that are presented here in the webinars, any additional resources to any of your work, and you can filter all of that through these tags right over here to your far right-hand side in that red circle. So it's a great learning community. Please chat us if you have any questions or reach out to us in email. And again, the web address is right there at the bottom. You can click on there to get started.
Great. Thank you so much, Tiara.
Beth, can I just add a few small points? I'm so sorry.
Sure.
I just wanted to put a little bit more of a plug, because you all know Beth and I, and you know how we love that we get such large participation and registrations. We only launched this Absorb system with 3 learning communities initially, and Beth and I would love to see our numbers skyrocket. So please join. Invite your system partners to join. And remember, this is a platform that we can have some interactive communication in between learning community meetings because there's all sorts of chat features and all fancy stuff that I'm still learning. So yes, help us with our numbers. And with that, I'm going to turn it back to you, Beth, and I promise to not talk again for a while.
And you can talk anytime you please. And yes, we really want to be the best, so help us out. Thank you so much in advance for signing up. We appreciate it. Let's move to today's session. The objectives are on this slide. As I mentioned, we'll focus on state-local partnerships, and I think you all know that those are essential for widespread adoption of the system of care approach across states and also for sustaining them over the long run. And the objectives for today's session are to discuss strategies for states and tribes and territories to create effective partnerships with local communities for expansion more broadly, to outline the roles of states, and I will use the term states as an inclusive term of tribes and territories that have smaller jurisdictions within them. So the role of states and the role of local communities within their jurisdictions in local expansion and sustainability, to provide some guidance for partnerships that emerged from an exploration and an expert panel that we did a couple years back on this. And then we'll highlight examples from 3 states that have different structures to illustrate their partnership strategies and how they've been used for widespread adoption of the system of care approach. And as I mentioned before, we'll have time for questions and answers. I will start by providing a brief framework for the discussion, again based on that exploration we did before, and then we'll have examples from 3 states. First, Shamika Williams will talk about partnerships in Oklahoma. Shamika is the Director of Oklahoma's Statewide System of Care for the Oklahoma Department of Mental Health and Substance Abuse Services. That will be followed by Cyrilla Blackman and Bonnie Rain, who will describe their partnership strategies in Indiana. Cyrilla is the Deputy Director at the state level, the Family and Social Services Administration in the state's Division of Mental Health and Addiction. And Bonnie is the coordinator of a local system of care in Elkhart County called The Source. And then we'll move to New York, where Angela Keller will describe New York's approach to partnerships. She's the co-director of New York State Systems of Care in the State Office of Mental Health, Division of Integrated Community Services for Children and Families. I'd really like to thank them in advance for their great work in putting this session together, and I will start with the framework piece. First, I think, or I hope that many of you are familiar with some of the work that we did on system change and what it takes to implement an innovation, any innovation, the system of care approach being one of them. And we have had 5 core strategy areas. Each of them have sub-strategies, but the 5 core system change strategies are policy and partnership changes, services and supports, financing, workforce development, and strategic communications. And we've also looked, since the federal efforts on expansion were initiated, on what are some of the overall approaches that states have used for widespread adoption. And we've identified in the slide, as you could see, a few: geographic expansion, sequentially adding regions or counties, as well as some other approaches, like starting with a particular age band, or by level of need, or funding eligibility, or for children and youth involved in a particular system. But the one most relevant here is geographic expansion for a systematic and sequential approach to add new counties and new regions to the work that the state is doing. And in the early stages of these efforts, what we learned very clearly and in the beginning really is that system of care expansion is a multi-level process, and changes at both the state and local levels are needed. Changes at one of those levels are not sufficient alone, and that state-level system changes have to be accompanied by local changes where infrastructure and services for systems of care are implemented, and also local implementation has to be accompanied by the state-level changes in policy, financing, services, workforce, and such to expand more broadly and for sustaining the approach. So we need what we have called a bi-directional approach, and it's really the synergy between that top-down and bottom-up approach that are needed for system change. And some of these early observations led to some changes in the SAMHSA, System of Care Expansion and Sustainability Grants, and you'll see those in the new FOA as well, that states must identify communities in which they will implement their strategies and also demonstrate how they will expand to other areas. And local areas must also demonstrate in their applications and the how they're going to be working with the state for the higher level systemic changes, for example, in policy, financing, workforce, and such. And one of the things that we've noticed at the TA network as we work with many of you in providing TA is that partnerships occur in many different contexts, and each have their own opportunities and challenges. And here are a few of them. There are many different iterations of this, and certainly this is not an exhaustive list. But there could be states that have a system of care grant and locally designated implementation sites. There could be local grants that are not attached to state grants, and there is no state grant in that particular state. There could be separate state and local grants in a state. And there could be various combinations of these or no current state or local grants. But we have found that there are perhaps different strategies and challenges in each of those contexts, and I think it would be helpful for you to give some thought about what context you are operating within and how that impacts how you approach the notion of partnering between your state and your local jurisdictions. And as I mentioned, we did undertake a project to look at how states and communities are working together and describe that. And the goal was to provide some guidance for other states and communities on strategies to achieve, of course, their shared goals. And we looked at 12 states and 4 communities that identified as having good partnerships. And then that was followed by an expert panel convened by SAMHSA. And both of those documents are in the box where you can download them if you see under the public chat. The reports from both of those efforts, which will give you more information about them. One of the things that we included in actually both documents is a look at what the roles of states and communities are in system of care expansion and how you can see that they dovetail and they do go hand in glove. So having one without the other is not sufficient to get the job done. You can see the roles of states are around a statewide vision and strategy, statewide policies, maybe legislation, interagency partnerships at the executive state level, financing and providing TA, collecting data and analyzing data that would support expansion statewide, and generating support among the higher level decision makers. All of those, and I'm sure there are others, are roles of states. And for communities, of course, that's where systems of care are being implemented on the ground level. It's testing and piloting approaches. It's implementing the infrastructure and developing and providing the effective services and supports that are associated with the system of care approach. Establishing local interagency partnerships, providing data that helps make the case statewide, not just in a local jurisdiction. Providing advice and consultation and participating in statewide expansion planning and implementation efforts, training, contributing to the development of family and youth organizations throughout the state, and developing leaders. So again, there may be more, but this is, I think, a good start at looking at what the various roles of states and communities can be and how both are important, and one without the other wouldn't be sufficient in order to get the job done. This is a pyramid of system change that came out of that expert panel, and you can see that it involves a shared mission, system changes, implementation, of infrastructure and services and positive results that lead to expansion. And all of this requires state and local participation. So now we have a poll that Tiara is going to put up on the screen to see how strong you feel the state-community partnerships are in your state. So far, somewhat. Looking like the winner. Okay, so it looks like somewhat, and that we have a way to go in terms of improving partnerships in your states, and so hopefully some of the strategies that you hear today will inform your work to do that. Tiara, you can move on to the next slide. So we did develop some guidance for effective partnerships, and they all kind of cluster around shared vision and goals and buy-in at both levels, recognition, again, that system changes are needed at both levels, creating a win-win strategy that ensure that both states and communities benefit and work together and leverage each other's work. And then there was some specific advice for communication structures and processes, and I'm going to just go through that very quickly before we get to our examples. Communication was top on the list in terms of regular opportunities for continuous communication. They could be structures and processes like teams, groups, conference calls, regular meetings. Also clarity about goals and about the role of each level to achieve them. And a number of places recommended using facilitators or liaisons or coaches that are mechanisms and vehicles to ensure frequent and productive communication. Another area was in terms of structures. And states, it was recommended that states involve communities early in planning and implementation, that partnerships are formalized, whether it's in MOUs, contracts, or agreements, that community representatives are on state teams, that there are processes for states to learn from the experience of communities, that there's an effort to make sure that state and community work is aligned and we avoid what we call mission disparity, training and technical assistance. Here's one that I think is important, is that there should be strategies that are adopted that can be replicated in other communities, and strategies for communities to provide TA statewide. Providing a coach that is not in an oversight role, but that is in a TA role, and ensuring that state policies are realistic and workable at the local level. What should communities do? They should ensure that their local activities are linked to larger systemic changes at the state level, understand financing, budget, legislation, processes at the state level so that they can get involved effectively, reach out with ideas and suggestions, demonstrate how the local work ties into work at the state level and will further state goals, which I think is essential, along with participating in state planning, and recruiting state agencies to participate in your local expansion efforts. And we've seen this. I see a number of you who are participants who have already done that, where there are state representatives who participate on your teams, and providing information that demonstrate how your work has statewide significance, and also providing training to other areas in the state. It's also suggested that states provide some funding to communities, maybe as an incentive to become involved, financing for infrastructure services, and using grant funds as seed money to help communities get started, with, of course, the goal of long-term financing. And so we like to think of using grant funds as venture capital. Leadership is another one, to ensure that the right players from states and communities are at the table, that high-level decision makers are involved, and that they have the authority to make decisions based on your partnership work, and that strong family and youth voice are incorporated in the expansion process at both levels. And generating support for expansion, that strategic communications are used to generate support at both levels, and particularly that data on outcomes and cost savings from the local level and state level are used and harnessed to make the case for systems of care statewide. And I think that's one of the things that frameworks will be able to help us with in terms of how to craft strategic communications so that it does make an impact on those, especially decision makers, who will be allocating resources and determining how much effort will be put in to system of care expansion. So with that as a framework, I'm going to turn this over to Shamika to talk about what expansion strategies have been used in Oklahoma.
Thank you, Beth. So my hope is to be able to share how Oklahoma Systems of Care is the behavioral health system for children, youth, and families in the state of Oklahoma. Our system is like the umbrella for behavioral health services. I want to talk a little bit about how we partner with communities as a state system. We've developed an infrastructure to support communities as well as service providers, and then the different funding streams that we use. Something that will be unique for Oklahoma, we are a rural and frontier state. We do have two major urban areas, but for those individuals that are from places that are more rural, this could potentially be helpful. As a part of our statewide goals, we really wanted to work with our local communities, all 77 communities in the state of Oklahoma, in order to develop community infrastructures. We wanted to make sure that as a part of that infrastructure, wraparound was a model that we utilized in order to care for kids that were more on the severe range. In addition to that, we also wanted to look at, one, some of the significant outcomes that came along with the wraparound process and the outcomes that came along with developing a community system of support for kids. As a part of this, I'll also share a little bit about how we've created a trauma-informed system to support our community base, as well as how we utilize funding streams such as the Health Home Initiative as a way to better provide integrated care for kids in the state of Oklahoma. In the state of Oklahoma, our structure is pretty much, we have a governor. The governor does not currently appoint our commissioner. Our commissioner works for an actual board that is the hiring board for our agency. Our governor can, veto any type of legislation. Most of our state agencies, directors are appointed. We have 5 different child serving agencies that are currently not appointed right now. We're looking at possibly moving in a direction where those appointments will be made. What that helps with us is that when we have a commissioner that is has oversight by a board, oftentimes that commissioner is in place over a long length of time. Currently right now, I believe our commissioner has been in place for about 12 years, which provides a consistent level of direction for our agencies. And in some other agencies that are appointed by governors, those roles turn over every time we appoint a new governor. The way we support our system, we have 77 counties in the state of Oklahoma. We know that each of our counties are quite different. And so as a state system, we've worked with all 77 counties in order to develop local infrastructure. The local infrastructure is the infrastructure that identifies what we call host agency, which is the Medicaid provider, to be the lead agency for the Systems of Care initiative in our state. You'll take a look at this timeline, this service tier. We started in 2 counties back in 1999, Kay County and Tulsa County. And as a part of that, we've grown tremendously. We did everything from initiate services, family support services for families, making sure those services were sustainable through Medicaid billing. We've been able to initiate a second level of tier for wraparound, which we call our service coordination model, as a part of serving kids that are not as severe as kids that need the wraparound model, but kids that need some types of supports and coordination. We've also looked at, we've also been a state that has initiated the Health Home implementation as an integrated care to actually look at how to utilize that federal dollar to support our wraparound model, as well as really look at how primary care plays a part in that as well. We've been able to expand services in the schools, utilizing what we call behavioral intervention support services, as well as initiate an early childhood initiative. We've done work around everything from trauma-informed types of work. We've worked really hard over the course of 18 years in order to develop an outcome-based system where we actually utilize our state and local data in order to drive funding at the state level. And so these are just some of the things that we've been able to do over the course of the 18 years where we've been really moving in the direction of a statewide systems of care. Our systems of care is from everything from 0 up to the age of 25. The Department of Mental Health is the state agency. It is also the Mental Health Authority as well as the Medicaid agency for behavioral health services in the state of Oklahoma. We really work to support and have grown our local system through leveraging both state and federal dollars. I mentioned earlier, as we have really shown significant outcomes around our wraparound model and our model for services, we've utilized those outcomes to leverage some legislative funding. Our structure, let me go to the next slide, kind of talks a little bit about our structure. Well, this next slide really talks about the growth over time that we have had in Oklahoma, starting in 1999, initiating the funding for our first 2 pilots in 2000 all the way to 2015. And you can see the onboarding of our communities over time. How we onboarded those communities was really about when those communities were ready. During that time process, as we work with one of our communities, other communities begin to hear about this local systems initiative and begin to call and contact us and say, we're really interested. We have families and kids in our network that can definitely benefit from these types of services. Again, as you'll see our map, since 2014, how we've even grown beyond that. As we've implemented the Integrated Care Initiative, we went from serving 2,300 kids to over 13,000 kids in the state of Oklahoma in 2018. And so our service model has grown. We've grown and expanded services, not just for children and families. We've also expanded services to include the early infant mental health population, so the 0 to 5. In our state, as you'll see on this funding map, we go after our federal dollars as far as grants. We also look at options like Medicaid options as a way of funding services that we provide. I mentioned the fact that we utilize our outcomes in our state to leverage some of our state dollars in order to look at how do we sustain our services and our supports once these grants are over. And we've been successful in that. We've been able to sustain our infrastructure, our state infrastructure that supports all 77 local communities. We've been able to do what we call braided funding or some collaborations with the Department of Education, Department of Human Services. We're also under a new partnership with the Office of Juvenile Affairs at this particular time. We do allow private insurance to pay for our services. When private insurances pay for those services, we like to leverage that as well. And then we work through our Healthcare Authority, which is our Medicaid agency, to really look at funding streams like currently right now we are a CCBHC state, that's a Certified Community Behavioral Health Center, where we're looking at options like that to continue funding services for children and families. This is our state structure. Our state structure is pretty much governed by it initially started with a partnership on children's behavioral health. It started out of our governor's cabinet through a transformation grant. Since then, we've been able to continue to maintain that partnership. That partnership exists with all of our child serving state agencies, as well as our children's advisory work group, which is really the kind of the movers of the shakers, the individuals that are the directors of these child serving agencies that direct services in child welfare, juvenile justice, mental health, as well as DRS. Individuals that really work on behalf of children, youth, and families. We also have what we call a state advisory team. Our state advisory team is a group of those individuals as well as family members, advocacy organizations, youth, who make up our state advisory team, who really advise us on really our local initiative. We also receive information from our local community teams that really come up in order to share what's going on, what are some of the things that are happening around children's behavioral health in their communities. We've had different committees over time to bust barriers, to look at finance and sustainability. We have a quality assurance. Again, we have everything from family drug court to transition services for transition-age youth, early infant mental health services, and then also we look at everything from workforce development. Our infrastructure has grown over time as we've grown as a state, really looking at key individuals that are experts around everything from family involvement all the way up to we have individuals that are responsible for training and technical assistance to sites, social marketing, tribal relations, substance abuse and co-occurrence services, and as well as cultural and linguistic competence. We have state coaches that also provide support to our field staff, as well as our state individuals really support our local communities. This right here really talks about the funding structure through our RFP process. Our process is very similar to the process that you see with SAMHSA. Over the last 10 years that we've really looked at how to fund sites, we work with our advocacy agency, the Evolution Foundation, which is family members that have had kids or raised kids with severe mental health issues. Is one of our organizations we work to, where they go out to our local communities to provide the technical assistance. When they're providing the technical assistance, they provide the directions for communities in order to get ready and prepared for the RFP when the RFP come out. And so they begin to have these conversations around the values and principles of systems of care. Why are these things significant? How do you begin to not only leverage services for kids and families, but how do you eliminate some of the barriers that they face, such as, suspensions and detentions? How do you, as a community, fight through some of the battles that families who have kids with mental health issues in the juvenile justice system? How do you do those things? So they have these conversations with communities up front to prepare these communities for this RFP that comes out. Once the RFP comes out, then these communities work with what we call a host agency. A host agency is a certified Medicaid provider. They have to be in good standings with our Medicaid authority in order to be a host agency. That agency becomes the lead agency for that community around the systems of care work. And what we do is, as you see, in our host agency, we fund structures such as a project director. We fund the actual wraparound staff, the care coordinators and the family support providers. We work with our host agencies to really look at areas such as what is the vision for this community and really plan around that vision. We help them to develop a structure for a referral process. We help them to look at opportunities for staffing up. What is the population? How many staff? And then also making sure that families are involved from the beginning. We do budget work with them as well, and then also really look at a process for service delivery. In addition to that, the service array that you'll see to the right is really our statewide service array. We want to make sure that our families in the state of Oklahoma have a multitude of services that they have access to when, in fact, they need access to these services. And so it's everything from screening, referral, and assessment all the way to hiring services such as inpatient care. We are a big state that really is looking at a full continuum for our kids, regardless if they're in rural Oklahoma or regardless if they're in an urban area. Again, our state partners, I mentioned that we have our state advisory team where we actually have partners from everywhere, from the Department of Education all the way to Human Services, any child serving agency. But we also try to duplicate that at the local level. It's not just important for us as a state system to have these types of partnerships. It's also important for our local communities to have these types of partnerships. So we really look at how do we duplicate these partnerships in our local communities and really work with our communities to have these types of partnerships, to come to the table to really work on behalf of the families and the kids that need it. Okay. As you'll see, this arrow kind of talks about the local interest and the initiation of it and how we provide the technical assistance through the Evolution, which is our Oklahoma Federation of Families Network. The application for funding comes out. We fund our communities, and we continue to provide ongoing TA support, coaching. When we work with our communities, that infrastructure is something that they don't pay for this support. When we work with our providers, we provide the training and technical assistance at no charge. We do a lot of training because, we're fortunate as a state to, when we're fortunate as a state to receive federal grants, we're able to offer different evidence-based models around the early infant mental health and the transition age youth, as well as modalities such as, seeking safety, celebrating families, and other modalities around trauma. So we offer that training and technical assistance at no charge. And then over time, we continue to work with our providers to do a local evaluation. Again, over time, we've done federal evaluation, but we wanted to implement our own local evaluation, so we have an evaluation process for our local communities that we utilize, not just to leverage, but to check to see and to make sure the outcomes that we're trying to gain is there. This next slide talks a little bit about our staffing and some of our trainings. We do have everything from individuals that specialize in trauma work to substance abuse. We have wellness services as well. We provide a variety of services. Some of our trainings are online. We have an online web-based system that a lot of our RAP one-on-ones come out of. We provide certain certifications for case management type of certifications here. And again, those services and those supports are offered at no charge to our providers. Our system is really built on a foundation of a family-driven youth guidance system. It's really important for us, not just at the local level, that they have youth and families that are involved in the community teams, that they have youth and we have youth and families involved in our state teams. When we, again, are looking at policies and procedures and service models, we incorporate family members to provide a direction for us. We hire family members as key staff positions. We've professionalized that. And those services are billable through Medicaid, as well as certain aspects of the services are billable to us as the state. We are, one of the things that's really unique about that is that the foundation of our systems of care, which is committed to those values and principles, when we have stayed committed to that at every level of our system, it helped to drive our system. And so over the last 17 years, as we've developed and as we've grown, our family movement has been at the forefront of our movement, talking to their legislators about why these services and supports are important to us. And so again, over time, we've been grateful to have secured funding from our legislators to help us to sustain after our grants have went away. These are some of the elements that we look at for growth and sustainability. Of course, that state level infrastructure that's directly connected to the communities. We have this bottom-up, top-down type of approach that we work with for our communities to inform us and really what it is that they feel like they need. Also, what we found with that is a lot of times where there aren't any state resources, communities are very resourceful in order to come up with resources for families. We continue to provide ongoing community support and local partnership meetings. And so our meetings are not just held at the state office in Oklahoma City. We go out in our communities and we have everything from regional meetings, regional trainings, regional options, and sometimes we have options for community to community. I mentioned the readiness and development plan, so we walk every step with our communities to make sure that they're ready and they are developing over time. And then also making sure that we have strong local service delivery in the wraparound model. It's really important for us that our services are not just, that they're evidence-based services, but we're gaining the outcome that we need in order to show the effectiveness of our services. Wraparound has been the model that we've used for years to support the higher end population kids that are SED, and what we've been able to show over time that wraparound is a model that works in the state of Oklahoma. And then also really sharing our positive outcomes in social marketing activities. Again, we kind of go with the philosophy is not one thing works without the other. We don't feel like as a state system, our system could work the way it does without our communities and without our youth and families. I mentioned earlier today that, again, as we've expanded across the state, I directly associate that expansion movement with our families. Our families in one community who are having success with their kids and being able to manage and maintain their kids at home. Again, that word gets out, and families and community members from other communities, whether we're talking about child welfare workers who have had experience or teachers sharing their experience, had really generated an interest over time, to the point where communities were calling us and saying, hey, how do we get this systems of care thing? How do we learn more about it? And at that same point, we're approaching their legislators in order to really say we need these services. This right here kind of talks a little bit, this slide here talks a little bit about our state level and how we aim to be integrated. We strategize and we create activities and processes that actually has the ability to impact the state. We get the information on the changes that we need to make from our local communities and our service providers. We work to increase collaborations. Again, right now, as we're looking at integrated care, working with primary care physicians, working with medical homes is things that we're doing right now. What we know is that if we can maintain kids and get them the physical health services that they need early on, they're less likely to be at a severe physical level when they get to be an adult. Also at the community level, we aim to continue to increase partnership and capacity, but we also aim to reduce disparities for our population. We know that kids with mental health disorders are more than likely to become adults with mental health disorders, and they're more than likely to die even faster than the average adult. And so really looking at disparities like that, but then also looking at disparities as it relates to culture, age, gender, and those things. We work with diverse communities. We're a rich native state. We like to work with our tribal partners. We are a state that has high population of Hispanic families, and so again, working with that population, as well as really looking at the overrepresentation of African Americans in the juvenile justice and child welfare system. So really looking at all those different levels as it relates to disparities in our communities. Again, we have 3 levels of care that we look at: is wraparound service coordinator, service coordination, and community linkage. We depend on our communities to make sure that any time a referral comes through that these families don't walk away without any services or supports. And so really looking at how do we keep them connected to their community, or how do we provide advanced levels of services. And then ultimately really data mining our data and really working with our families on family surveys and allowing them to participate in our quality assurance process to see how do we continue to work to improve these outcomes. We work a lot with the Technical Assistance Network and other state-level entities to provide us with insight on our infrastructure and support. And then also this right here talks a little bit more about how we meet our communities where they are, developing the readiness assessment, building the RFP to address the unique community needs. You know, in our RFP process, one of the things that was really important for us is not just to develop an RFP geared towards a particular population of children and families who have mental health disorders, but also really look at what are the uniqueness of your community? What are some of the things that you guys as a community struggle with this population? And so through that process, we were able to identify community uniqueness in certain areas of Oklahoma where substance abuse were high, the needs were higher. But then there were other areas where it wasn't as high. There were areas in our state where we work with our communities and we find out that we had, areas, issues such as transportation, and really create unique partnerships where we were able to resolve some of those issues so that people can get access to treatment by being transported. And then also the technical assistance support by the family lead organizations. Again, our family lead orgs that we contract with state, those are really important contracts for us because these are actual family members who have been through the system, worked through the system, and came out successfully, where they're actually working to develop leadership around these types of family movements, utilizing their time to give back to their communities and provide training and technical assistance around the importance in which that is the values and principles of our systems of care and why those things are significant, and really sharing their stories with that. And then making sure that those key partners involved also share the vision. Oftentimes when you work with partners like Office of Juvenile Affairs, who's really working around community safety, it was really important for us to really align and talk about the things that we have in common, but then also the things that we have that are not in common, and really line a vision around how our agencies are going to work together in order to support these families and kids.
Shamika, this is Beth. Your next two slides really focus on how you have evaluated some of the work you're doing and some of the outcomes of your work, but I think this might be a good stopping point on the state-local strategies and move to Indiana and hear how they're approaching this.
Sure.
Those slides are there, and everybody can take a look at them on your own, because I think it gives you a sense of how you can evaluate outcomes and how that is impacted by these kinds of partnerships. So
Sure.
if it's okay with you, let's move to Indiana, and thank you so much, Shamika.
Sure.
Thank you, Beth. Thank you, Shamika. I'll be getting with you to learn more about your system in Oklahoma. I just want to give some context around Indiana structure. Our structure is largely a state-operated system. The Division of Mental Health and Addiction is the state mental health authority. We currently have 24 certified community health centers, and there are state public safety net for the provision of both mental health and behavioral health services. We have contracts with our community mental health centers through our block grant funding and some other discretionary funding to ensure that the needs of individuals identified with seriously mental illness and seriously emotional disturbance and chronic addiction are insured services. Historically, due to the Medicaid payment system, we really broadly have coverage for our children, and so the majority of our federal funding has been directed to support mostly adults and other services. But what we have that is really nice, the legislation has mandated that we have a child psychiatric fund, so we can support the delivery of other supports and systems and services for kids in the state. So for us to succeed, System of Care, we know with that discretionary funds that we truly have to have a true state and local partnership and provide the vision and leadership in regard to supporting local communities with financing, technical assistance, and collaborative opportunities. Our System of Care has been an integral part of the development of our Indiana child behavioral health system since the mid-90s. I often amazed in looking back over the 5 years, maybe 6, that before at the state we had a department of 1. We now have 18, and we're still growing for our youth services here at the state. When SAMHSA, we were awarded a 4-year implementation grant in 2014 and to implement a strategic plan for continued state-level System of Care development and support to the local SOC sites statewide. We had a really awesome turnout. We had individuals from schools, juvenile justice, we had students, we had parents, we had lots of people from child welfare to come and talk about what they perceived the needs were in terms of mental health. And so we were able from that input and feedback to successfully implement several strategies and initiatives in building the infrastructure for both at the state and local levels. Here, this just gives an outline of where we've been and where we're at now. In terms, we started out with the Robert Wood Johnson grant, the Dawn Project, where we looked at the kids who had the highest needs and how we were able to provide support to them, those children. And where we're at now, we have a state plan amendment. It's our child mental health high fidelity wraparound. We currently have 5 coaches here at the state who are our QI and provide training and oversight to our wraparound sites within the state. We work with the University of Washington with their National Wraparound Implementation Academy, which is a part of our system of care. But the way we decided to go is really focus on communities in terms of access to care, in terms of the full array of services. And also what's not on here, and I will go to that Senate Bill 125, went into law effective July 1, 2013, and that was legislatively mandated, which has been wonderful, and it's a multi-branch statewide commission aimed at improving the status of children in Indiana. So it really opened cross-collaboration among child-serving entities to look at the welfare of all children. We identified shared goals and interests across child-serving agencies, and we looked at how that aligns with the goals and strategies of the system of care, that provided a platform and opportunity to educate other state agencies and partners in regard to the values and principles. We were easily able to identify key stakeholders, prime movers, to promote system change, and to just share in as much as we can encourage development of the system of care framework, and also opportunity to amplify youth and family voice. The planning phase for the state, and what was interesting for us, that when we applied for the implementation and expansion grant, it was really to focus on building the state infrastructure and our ability to support local communities. And kind of what transpired was we kind of did both at the same time. So in doing that, we invited a cross-section of parents, youth, stakeholders, prime movers in the community, and state-serving agencies to attend a facilitated meeting. The goal was structured around to identify gaps, strengths, barriers within and cross systems through very strategic conversations. I think Beth mentioned earlier about having a facilitator or facilitated conversation really will get you to what you want your end goal to be. We took feedback, comments that were formulated for developing a strategic plan. Just, I think it's important when communities, stakeholders see their own language, what they perceive needs to happen, coming up with solutions. If they could see their voice in any plan, helps with the buy-in for that structure. And then we had a system of care conference in 2013, and we presented a draft of that strategic plan in a session. So usually at those conferences, we get anywhere between 400, 500, and over the years it's grown to 600 attendees to really we were able to get feedback, which is very important because we at the state know we may have an idea of how things should transpire where we need the input from the communities as well, so they're not saying, what is the state thinking about moving forward? In terms of, and what I want to just lay out to be helpful, just to kind of give you an idea of kind of where we started, then where we transpired to, and where we're at now, we had an existing Child Mental Health Advisory Board. And that originated when we had a Child Adolescent Psychiatric Residential Facilities Demonstration Grant that required that we have a advisory board. And so that board was, we had great attendance. It was cross-sectional, cross-representative of many agencies and family and youth participation. And so when we had our system of care grant, we just used that group to embody our system of care board. So we identified stakeholders and champions to support system change at both the state and local communities. We really worked hard to strive for 50% of the board to be representative by youth and family, and I would say that is very important. We have them give input in regard to any policies, give input about directions and priorities that the state was thinking about going into, so they had a lot of say in what we did as a system of care. The board had subcommittees that mirrored areas of our strategic plan for system of care. We also offered free trainings and community conversations throughout the state with a focus on system of care values, especially in the area of equity and diversity, which I would say started out slowly. I think people were pretty apprehensive to what was that going to look like when it becomes to conversations around racial equity, gender, but now I would say we have overwhelming requests all throughout the state in regard to those conversations. The way we structured our system of care, we did a request for proposals. We were able to fund 18 local sites. That did not come out of our grant funding. That came out of our state funding. The reason why we did that, because we wanted to ensure some infrastructure and sustainability in supporting the local communities. We also had other strategies, and we put system of care language in our request for proposals for other child contracts. We tried to get them to really embrace their values, so when they presented a proposal, we really looked at how they were able to incorporate system of care values and principles in their contract language. We realized the importance of having a strong technical assistant that was supportive for the community. So one of the things we really invested in is having a TA to go out to the communities to give the state feedback. I think that's really important because I think we get lost sometimes in thinking that people know and understand what the direction we have, and we really got some really good feedback for us and some things we needed to tweak and change in our infrastructure. So I think when you look at building that tie between state and local partnerships, that feedback from the community is just invaluable. We provided infrastructure for our system of care coordinators. So what we have done with our local communities, we fund a coordinator to help pull those local agencies' resources together so they can work within those communities to address issues in terms of access to care. So we have monthly calls with all of our system of care coordinators, and I will say we have funded and not funded coordinators on those calls, and then we hold face-to-face quarterly meetings as well. I can't stress the importance of data, that's really important for us to look at because that provides ongoing credibility to improve and sustain our system of care infrastructure. Through periodic administration, we had our system of care implementation survey regarding state and local system of care implementation, and it was helpful barometer for us to know, like, we sit midway in terms of where we're at as a state, as a child-serving system. So we're able to look at where we also need to go with that. like I said, we support an annual statewide conference to provide TA and networking opportunities for stakeholders. We really strategically invested in our youth and family support. We provided them with additional technical assistance. We helped them develop their own technical assistant tools so they can engage families and youth and support the local system of care who struggled in engaging youth at the local level. We provided funding for that group so they can have Zoom meetings so they can reach out to more families within the state as well. And our goal is to help support a family and youth networking support agency for the state.
Cirilla, thank you so much. I'm a little concerned about the time.
Yes.
And we're going to turn this over to Bonnie to talk a little bit about this from the local perspective. And we also want to make sure we have time for New York. We will remain on the line a little bit over for Q&A, and also we will be responding to some of the questions that you asked in our follow-up email as well. So let's turn it over to Bonnie, and then hopefully we want to make sure that we have enough time to talk about Angela's strategies also.
Thanks, Beth and Cirilla. I just want to say that when we're looking at the Elkhart County System of Care development opportunity, I think we're looking at a kind of case study in how state and local partnerships function in our state. As Cirilla mentioned in her timeline, we were a 2016 CMHI expansion cohort grantee, and to just refer back to Beth's context, looking at the partnership context, that would make the state and local both separate grantees. So we weren't connected necessarily in our grant work. But I think what we have here is a good example of the bi-directional approach that Beth described earlier, with locals partnering with the state in those high-level systemic changes, policy, financing, et cetera, so we could impact improved access to children's mental health for youth and families. This slide kind of gives you an overview of how we've participated over the years, and what we've tried to do was take advantage of every single opportunity from the Department of Mental Health and Addiction forward. So in our expansion grant, we could obviously click through these, and you'd recognize several of them as responsive to the SAMHSA Children's Mental Health Expansion template. However, what I want to do is highlight three that are clearly a reflection of state system of care infrastructure and services leadership, as well as our local community's priorities. So if you look really at the first three, access to children's mental health is part and parcel of the Indiana System of Care purpose. The second bullet, supports for mental wellness for young children, was related to a state initiative to crosswalk the 0 to 5 categories to DSM-5 to serve children who have clinically significant social and emotional challenges. And the third is the safe diversion of youth with mental health challenges from juvenile justice system, and that's compatible with our state system of care partnership with the Juvenile Detention Alternatives Initiative. So all of these things are things that we're doing, and I won't go through any of them because any more of them because we're out of time, but just to say that those three highlights are where we have really close connection with what the state's initiatives were and what their leadership has been over time. Now this is our logic model, and it illustrates the pathway that we propose to our ultimate goals to increase access and improve emotional well-being of youth. And while this is heavily seated in our local efforts, hopefully you can see how this stands really on the state platform through funding, leadership, and chosen activities and strategies. We've had several examples here of what we've done in terms of the work that is outlined in our expansion project. These are some of the partnerships that have influenced our development. And we hope that they've, at least Cirilla had a modest impact on the system development writ large at the state level. My favorite summary characterization of what we've done, we think, is really that first bullet point, being locally driven community work, coordinating with and benefiting from and supporting state system of care development. In some ways, the second bullet, the state's long-standing support of system of care development and high-fidelity wraparound, is where it all began for us. And then, of course, looking at the state-community partnership around those multiple partners. These are the folks that are at the table locally, but they're also the folks that Cirilla pointed out are at the table in the Commission on the Status of Children. So we've got all the synergy both at the state level and the local level. And I'd say it's modeling. I'd say it's leadership. I'd say there's connection and communication. Again, going through those aspects of development that Beth referenced earlier. Finally, looking at our social marketing synergies and system of care essentials. Cyril, I don't know if we want to reference these last two slides or if we want to pass on to Angela. I don't know what you're thinking there, but these next two slides really summarize the outcome of our state and local efforts and maybe some of the challenges we've had. But given the time, perhaps we should, is it right to move on?
Yes, I think some of the outcomes are interesting and people can look at those on their own time. And I know that on slide 57, or I think it's 58 now, you outlined some of the challenges, which I think are important, and I would suggest that the participants take a look at that too. But I want to make sure that Angela has some time, and so if we could move on to New York, that would be terrific. Thank you so much.
Hi, good afternoon, everybody. Luckily, there's a lot of detail on my slide, so I think I can get through this in the amount of time that we have, and we might even have time for a question. First, I want to give everybody just a real brief, what is New York State structure? So we're divided into 57 counties and the 5 boroughs of New York City. All of our public services are county run, and those structures require the state agencies to partner closely with local government and community providers. There are 15 health and human services agencies, of which 8 have significant focus on children, youth, and families. Some of those, as listed on the slide, are under the governor's cabinet, but our state education department has a completely separate structure. That poses some challenges both at a state level and local level from time to time, but we do collaborate with them as well. So we have a population of 20 million people, of which 4 million are children under 18. 1.8 million children receive Medicaid, and they make up about 37% of the Medicaid population. In New York, only about 2.5% of children are uninsured. I'm citing those the Medicaid information because a lot of our service system is funded through Medicaid. So we've had a long, long history of developing a system of care on the local level. So we started that off in the mid-'80s with the first CASP grant that was awarded to the state, where we did a lot of training with local communities about what are those values that now have become so commonplace through system of care. The Children's Mental Health Plan in '92 and even more importantly in 2008 really became the focusing vision for New York State and where we wanted the children's systems to go. We've had 17 system of care grants throughout the state for both local communities and one currently that I represent on a statewide level. The Coordinated Children's Services Initiative, which I'll talk about shortly, and the Children's Plan have really been critical to laying that foundation for New York. So the Coordinated Children's Services Initiative started in 1993 when the Commissioner of the Office of Mental Health convened all the commissioners from the child serving systems to really look at a reduction in or reducing out-of-home placements for children with emotional or behavioral issues. We looked at the infusing core principles of interagency planning, integrated service delivery, strength-based approach, and individualized care, and helped localities create locally coordinated systems of care. We had an alignment at the state, county, and child serving levels through a three-tiered interagency structure that also had representation of families and youth on it. So the state level team was overseeing and providing guidance, also served as an entity where barriers and systems level challenges could come up to for resolution. County level systems really were that collaboration at the county level to share resources, problem solving, and then service delivery at the local level. So they had a lot of flexibility to develop whatever that infrastructure was, as long as it was consistent with the statute, which was passed in 2002. Most New York State counties have retained the CCSI structures in some way, shape, or form, even when the state ended formal funding about a decade ago. But it's really been the building block for all other interagency efforts. We're in the midst of a major transformation in New York State of our Medicaid system, and really the underpinning of this transformation and what we've planned over the last many years is really the system of care framework and the CCSI legacy. And you'll see on this, and I won't go into a lot of detail, what are the things that will be happening between now and the end of 2020. Our goal with the Medicaid transformation is that we have a more robust array of behavioral health services. We're able to intervene earlier when children and families are experiencing difficulties, and we can deliver services predominantly in the community. In the midst of the behavioral health transformation, our juvenile justice system and also our system that funds and oversees intellectual and developmental disability services is also undergoing changes. So there is not likely any children's system participant or provider that's not experiencing change today. And we really believe that the foundation of the interagency work through CCSI and the system of care values and principles in that framework are really going to help provide a strong foundation as all of this change happens. So our current system of care expansion grant, which began in 2016, builds upon all of New York's previous history, and we're looking at two aspects, is to develop and pilot our own model for high fidelity wraparound that will be integrated into New York's health homes for children, and also helping to rejuvenate the county system of care infrastructure across the state. So we're doing that through some practice and systems level collaboratives. We've developed some social marketing toolkits that localities can use on their own for their own education and outreach and campaigns, both around systems of care, youth and family peer workforce recruitment, and educating for people further around health home. We held a summit in September and required counties to bring teams of representation, representatives from a variety of different systems, and really began to talk about what might be those action steps that localities could take to rejuvenate system of care and get back on track if they had kind of gotten away from the CCSI structures. We just closed out a survey statewide to see where are we with system of care implementation and the retention of CCSI, and we're really looking forward to looking at those results to see where the state can be helpful in supporting that. So we've been engaged in a number of different activities. We have had some state and county sustainability planning. There are currently 5 other system of care expansion grants throughout the state. So we were trying to fold up their system, the county level sustainability planning into the state. states plan because they all are interconnected. So that's been a way that that partnership has been really important. We've had practice learning collaboratives around wraparound, system learning collaboratives around system of care implementation, and helping counties that may need a little more technical assistance from counties that are further along. We have provided system of care training materials, and those are continuing to be under development in addition to the social marketing toolkits I've already mentioned. And where we can, we're trying to facilitate strong cross-county sharing and assistance. We really believe that we've made significant progress in sustaining system of care in New York through these partnerships between the state and local communities. But in the future, I think the activity and energy at a local level will move us further in providing that foundation. So that's very, very fast with the time that we had left, and it looks like, Beth, we might have a chance for some questions.
Great.
Denise,
Sure.
Go ahead, Denise.
Sure. Yeah, before, Angela, you move off this slide, excuse me, somehow now I have Beth's cough over here. I just wanted you to tell a little bit more about your strategy specifically with social marketing, the RFP that you sent out statewide, and how your counties are able to adapt and use that.
Sure. We had engaged with a local marketing firm that helped us to develop 4 toolkits, and we put out an RFP in September and asked if health home lead agencies, care management agencies, local providers, county government wanted to apply to us to have all of the toolkit materials, which are also translated into 9 languages, to be personalized for their local community. So contact phone numbers, names, their logos, kind of what their local process might look like. And everyone who applied was awarded, and the marketing committee or contractor then personalized whatever materials they've requested to their local community. And then this year, all of those participants, I think there were about 65 entities that requested personalization, are conducting campaigns with those materials.
Great. I just think that's an excellent example of state and local partnership. And Angela posted a video, their history video, in the chat box. That history video was played at their statewide planning summit in September as well, and the counties are using that same video. So it's very cool. We did have, Tiara, for some reason I cannot advance my own slides. Could you just go to the next slide? I think it's the question slide. And we did have one question that hasn't been fully answered by, that came from Jessica. And she asked about a toolkit for these models. And I believe that Beth has posted or sent to Tiara a System of Care Expansion toolkit that is in the file box that you can download. And then, Shamika, does Oklahoma have anything that guides the implementation at the local level?
Yes.
That question did during your presentation.
Yes.
Great.
We do have a toolkit that we can provide, and we also share copies of an RFP that we've actually put out, and so I can provide that information as well.
Fantastic. Shamika, if you send that to me, I'll make sure I send it in my follow-up email to everybody who registered, and we'll also post it in our learning management system. Another great commercial for why you should all sign up and be part of our learning community, our online learning community. Tiara, if you could go to the next slide, please. We do also want to make sure that you're aware of our March 20th webinar. Beth mentioned this at the beginning. This will be the Frameworks Institute. We're really excited about working with frameworks and using science and research to help improve our communication. Please join us on that day, and it'll be, as Beth mentioned, part 1 of a 4-part series. And then we also really want you to stay online, as Beth mentioned, just for a few more minutes to give us feedback through our survey, to give us feedback both on this webinar as well as anything else you'd like us to cover in future months. And with that, I think we actually did it, Beth, and it's 3:59. So thank you, everyone. Thank you to all of our presenters. And for those of you in Tampa, please meet us at the poster session on Sunday night. And good luck with the weather for every one of you that is living east of Mississippi right now. We appreciate your time.
And thank you to Tiara for doing such a great job on the technology, as always. Have a good afternoon, everyone.
Thank you, Tiara.